Hi everyone, welcome to our panel. Today, ONS Staff Education SIG, which is the special community, is hosting their first panel, video series panel, where we are going to be talking about complementary and alternative medicine. So we're going to talk about what it is, why it's important, why we need to know about it, and to have this 360-degree view about complementary and alternative medicine and integrative medicine, we have a fantastic, a stellar panel. So I'm going to let the panel introduce themselves. So I will start from the extreme right with Anne. Anne, go ahead and introduce yourself, and then we will continue from there.
Thank you. I'm Anne Fonfa. I'm the founder of Annie Appleseed Project, patient advocate. I was diagnosed with breast cancer 23 years ago while suffering from extreme chemical sensitivity. I ended up being unable to take chemotherapy or radiation, and I had to find my way through the years, many years of recurrences, with natural therapies and lifestyle changes and things that helped me to survive. I discovered that those things were usable by people who were in conventional treatment to feel better and safer, healthier, calmer, happier, all the other things that we want for ourselves. And I've been putting that into my organization's information ever since.
Great. Linda?
Hi, I'm Linda Belnies. I'm the director of the Center for Integrative Medicine at the University of Toronto. I'm a registered nurse, but also a PhD-prepared researcher. And I guess for the past 20 years, I've been conducting research on how do we support people living with cancer and their families, as well as healthcare providers make informed decisions and evidence-based decisions around complementary medicine.
Fantastic. Welcome, Linda. Christina?
Hi, I'm Christina Gowan. I am a medical oncologist at Salish Cancer Center up in Tacoma, Washington, and also a medical researcher working with Mayo Clinic in Arizona University. I have particular interest in meditative movement and as a novel intervention and supportive therapy for cancer patients, and have clinical trials both in yoga and Tai Chi as novel supportive options.
Fantastic. Great. Next, we have Kathleen.
Hi, I'm Kathleen Sanders. I'm a family nurse practitioner for about 30 years now, with a strong interest in complementary medicine and complementary health. But I was able to do the fellowship in integrative medicine in Arizona that I completed in 2007. And so for the last 8 years, I've been able to work within several different institutions offering integrative medicine. My passion is mind-body medicine techniques and botanical medicine. And I'm newly hired at Columbia University at the Medical Center on the Oncology Department, offering my own clinical practice in integrative health to the patients there in the outpatient setting. And I'm very happy to be here.
Great, thank you, Kathleen. And now we have Liana, who is our co-host for this event, and she is the leader, the SIG leader for complementary and alternative medicine. So such an honor to have you, Liana, and co-host this event with us. Go ahead.
I'm Liana Wheatley. I live in Austin, Texas. I am the coordinator-elect of the Complementary and Integrative Therapies, a special interest group for the Oncology Nursing Society. I think that covered it. I'm a registered nurse, did I say that? And oncology certified for almost 20 years.
Wonderful, welcome. And thank you for helping us to host this panel. Next we have Suzanne.
Hello, I'm Suzanne Hanser. I chair the Music Therapy Department at Berklee College of Music in Boston. And I also was instrumental, if you pardon the expression, in establishing the music therapy service for the Zakim Center for Integrative Therapies at Dana-Farber Cancer Institute, also here in Boston.
Fantastic. Welcome. And last but not the least, we have Luana.
Hi, everyone, and thanks for having me. I'm so happy to be here. My name is Luana Deangelis, and I am the founder and director of You Can Thrive. And we are a nonprofit here in New York City. We've been running for 11 years, and we provide a multidisciplinary model for people with breast cancer and other types of cancers to have access to services that they can otherwise not afford. And it's a pretty interesting multidisciplinary model, and we have a lot of great outcome data, and so I'm anxious to be here and get to share that with everyone.
Fantastic. Welcome, everybody. This is such an honor to have all of you. So first thing we want to do is introduce the topic of complementary and alternative medicine and why it's important to nurses. So I will let Liana do the honor of talking about it as our leader in CAM at Oncology Nurses. Go ahead, Liana.
Okay. So I've actually been part of the Oncology Nursing Society Special Interest Group for, at that time it was called CAM, called Complementary and Alternative Medicine. I've been a member of the group for over 6 years and have been active for 6 years in the group. I initially started because I had patients coming to me asking for advice about things that were outside of the realm of Western medicine. And in the 6 years since I've really started my interest in that, the language has changed a lot. They changed from complementary and alternative to complementary and integrative therapies, because I believe the Western model has finally realized that these things are important and we need to integrate them so that we can provide better care instead of making people make a choice between one way and another way. Let's just bring it all together. So I think that it's awesome to see that the world is changing and we have people out there marching this path and leading the way to kind of open the field so that people can have everything that they want. They can have a Western medicine doctor, but they can also experience meditation, Reiki, music therapy, aromatherapy. So complementary and integrative therapies kind of encompasses everything that is non-Western, from traditional Chinese medicine, yoga, Ayurveda, to herbs, supplements, and music therapy. So it really is bringing that mind-body connection into play to help people with healing. My personal interest and passion has been meditation for a long time. I am a Qigong student. I've studied Qigong for going on 9 years now, and I have studied a particular form of medical Qigong, which is called Shengzhen Gong, and I have a daily practice of that. It's a moving form of meditation, and I have had profound physical, emotional, and spiritual changes through this practice. So I try to incorporate that in my everyday nursing, and I am really continuing to move in a world that offers that as part of standard care, because I think it's a huge part of standard care. So that was pretty lengthy, but that's my introduction to CAM.
No, that was a very good introduction, and thank you so much for bringing in your personal experience into it. And I think, like most of us have talked about it, we have a lot of interest in this area. I want to touch a little bit from the patient's perspective. So in US right now, the reason why this topic is important for all of us to know as nurses practicing in oncology is that on average about 30% of people use some form of complementary and alternative medicine, and this does not include prayer. And for oncology population, it can be up to 70%. So many of our patients, the people we are working with, the community we are serving, are using these different modalities to take care of themselves. So it's important for us to know about this and be aware, be educated, so we can serve them well. Now, the different kind of therapies that people are using ranges like what Liana touched on, from natural products, which is more than 20-30%, to deep breathing, about 10%, yoga and qigong, another 10%, chiropractor, meditation, massage, diet, homeopathy, progressive relaxation, guided imagery, music, and a lot more. So we hope that we can introduce some of these different modalities to you. And I hope that we start to ask this question to our community that we are serving, so they feel that they can open up and talk to us about it, and that it doesn't have to be something that they do in private, but we truly make an effort to understand. So it's great to have within ONS CAM-SIG, which specially focuses on that. And we also have with us today Linda, who represents SIO. So Linda, would you like to talk a little bit about SIO and SIO's role in this area? And what is SIO?
Sure. So SIO stands for the Society for Integrative Oncology. It's an interdisciplinary, multidisciplinary group that is now international. We have the majority of our members are from the US, but we have a growing body in Canada, as well as other countries around the world. You know, the real mission of SIO is to advance knowledge and the research around complementary and integrative therapies, as well as to ensure that that evidence is getting to the bedside for clinicians, nurses, oncologists, other specialists in cancer care, as well as to patients and the general public, so that people are aware of the latest evidence around the use of complementary and integrative therapies in cancer care, and aware of the benefits and as well as the potential risks. So it's really about advancing the field and creating a really strong evidence base around complementary medicine.
Fantastic. Thank you so much. And SIO is doing such wonderful work in this area. What's exciting is to see the interdisciplinary teams at SIO, which brings together so many different modalities and helps us to think beyond our spectrum that we are used to.
If people are, I just want to say a few more comments. If people are interested in coming to an SIO conference, our conference is going to be in Miami in November, actually the 5th and 7th this year. So if you're looking for a little break from the early winter weather, you're welcome to join us down in Miami. The focus of our conference this year is really advancing the global impact of integrative oncology, and we'll be reflecting on this field from a much more international perspective, and we'll be having international speakers from around the world joining us. I also want to let oncology nurses know, because many of them may not be aware, that the Society for Integrative Oncology for the last 5 years has been developing evidence summaries where we have taken the literature that's available around a variety of different complementary therapies, and we've done a systematic review and graded the evidence and have developed recommendations for people that are generally living with cancer, as well as have created specific ones for lung cancer as well as for breast cancer. And we plan on continuing to develop more of those evidence summaries and ensure that they are going to be distributed to clinicians as well as to the general public. So thank you for the opportunity to join you today.
Thank you so much, Linda. What we want to now hear is really the community we serve and why it's important. So I'm very excited to hear from Anne and from Luana, who represent the patient advocates in the cancer community, on why they think this is an important topic. Why is it important to them? Why is it important to other people in the community? What they think in terms of the resources that the community needs. What is the disconnect right now? How they are addressing this. More than anything, what we want to understand is how we as nurses and as healthcare professionals need to know more and what we can do more to serve the community. So I want to hand over the mic to Anne and then to Luana.
Yeah, thank you. So one of the issues for me is I just went in January to the ASCO's first ever survivorship meeting. And that meeting was really not about surviving cancer, but about surviving cancer treatment. And that's a really big concern. Many people, a lot of people are harmed short term. Many people are harmed long term, all different kinds of harms that we know. and it's been kind of an accepted thing that, suck it up, deal with cancer, but that's not okay anymore. But one of the issues I have with that is when we do a guidance that was just talked about, that's looking at level 1 evidence, which is very rare in the world of anything from natural products, natural therapies, natural lifestyle changes, anything like that. And my concern is that we're limiting the availability of information by saying we can only accept level 1. We really need to be more informative of that. The other thing is, I notice because there's an absence of guidance from the professional communities, people are really left hanging. So many people tell me they didn't even know that the cancer center or the clinic they went to had other resources because their doctor may have failed to mention it and perhaps their nurses failed to mention it. We rely on the nursing community to give us the guidance that is really missing all too often. I'm really happy that you're doing this. It's very, very necessary.
Wonderful. Thank you so much, Anne, for that perspective. And Anne has been doing a lot of work in this area with her organization, Annie Appleseed, where she provides a lot of resources on complementary and alternative medicine for the community.
Yeah, we do no services, just information through the website annieappleseedproject.org or Facebook and Twitter.
Great, fantastic. And Luana?
Hi, everyone. I run a foundation here in New York that does services. So Anne came before me, and she was disseminating information because I find that a lot of people with cancer lie or omit what they're doing because they don't feel supported by their medical providers. And also that even when the resources are there, as they are in New York, many medical providers don't refer or don't, when someone's saying, I have all these terrible side effects from from chemo, and they know that acupuncture is good, they won't recommend it because they're afraid. They won't say, maybe you want to reach out to try to get acupuncture, unless the person actually specifically says, I'm looking for integrative resources. They have to use this certain key language before the doctors or nurses will send them in the right direction. And so I think being a little bit more open to the patient's needs, and also understanding that these types of services are meditative in nature, and a lot of the objective is to relax the brain into lower frequency brainwave states where the body is in a bit more of a condition to heal. And it's very hard to get those types of brainwave states in a hospital setting because the hospital is associated as a point of trauma for many people because that's where they got their diagnosis, that's where they got their treatment. So it is important that we work together with the community resources and with the integrative providers to even allow communication so that the patient can get the best care when they are seeking these resources.
Yeah, great points. I think both Anne and Luana. So you talked about the gap that currently there's some gap in our research. We are making progress, but there's a long way to go for all of us, and what we can do in the meantime. Also, I think you touched on a very important topic, both of you, that the communication aspect that we are not bringing up, and at the same time, there is a certain language that, and only then there might potentially be resources that the patient community can get access to. One of the challenges that I think I have seen our nursing community face is we might not know about what kind of language to go for, and even if somebody did ask us, then how do we address it? What kind of resources are available to the community? So have you found great and reliable sites that are typically approved by the Western medical system that nurses can go read up on or share with their patients?
Well, You Can Thrive has a model that is multidisciplinary, and it's in New York and the surrounding areas. And I think that there are lots of great places like the Annie Appleseed Project to go and look at the evidence and look at the research papers. But moreover, the language, as you stated, is kind of important because I call integrative care now palliative care. Because when you look at the true meaning of palliative care, it is integrative care. It's addressing these issues of a life-threatening illness for patients and their caretakers, and addressing them not just with medicine, but it's spiritual, psychosocial, and mental, so and physical. So these are things that we need to address, and to me, it is integrative care. That's what you do aside from medicine, from the pain meds in the hospital setting. But we need to find a way to bring them to the patients that is accessible and that they can afford, and that starts earlier, please. Palliative shouldn't be associated with end of life. It should be from the moment they're diagnosed.
Absolutely. Today's newspaper and today's news was talking about the CDC's decision that opioids should not be made available the way they currently are. And that's really important and opens a door, I think, for more integrative care, because we need to recognize that those treatments are just not working for people. They're causing harms, tremendous harms, and we need to substitute the things that are gentler and kinder and that work.
Absolutely, Anne.
Great. How about I open it up for all of us on the panel to talk about how you think we can bring more of integrative medicine, complementary and integrative medicine to the mainstream, to the centers we are serving and to other centers. What can our nurses do at the various centers they're working at? What have you found that works? What can they refer to their patients? What can they talk to to their librarians or their staff about easy, simple things that can be done?
This is Suzanne, and I'd like to say that nurses are a key to communicating between the patients and the medical team. You nurses are aware of what the patient is going through, and you are a very real communication device who can inform patients and the medical specialists about alternatives that are indeed, as you say, and kinder and gentler.
And I really believe that nurses have a key role in terms of assessing for complementary medicine use and beginning that dialogue with patients and asking about the various therapies, both conventional as well as complementary, that patients may be using, ensuring that that gets documented into the patient records so that the whole healthcare team is aware of what that patient is using or perhaps interested in using. And I really believe nurses play a key role in shared decision making and referring patients to evidence-based resources, websites where they can actually look up information that's reliable and credible and be able to make decisions that are informed. And my research program in Vancouver and now in Toronto has been really focused on advancing nurses' skill set and their knowledge so that they're able to play that key role in the clinical setting.
And I think we've already identified some of the barriers for the underutilization of integrative medicine therapies in our cancer patients, and that is that very often, even if they exist within the cancer center, they are not known about. And so I really look at nurses as a liaison, as an integral part of the team in which they educate themselves, know what the services are that are offered within the cancer center and within the community, and how to make those really essential referrals, how to make those kind of suggestions to the providers if they need a referral. And so I truly look at them as an essential liaison to kind of make the connections that are needed. And then additionally, I really look at nurses as catalysts for this wave of change in integrative medicine. That what administrators and practitioners really need is excitement for these therapies for our patients. And I think if they start hearing this from the nurses, that they'll realize that the patients are asking for these services, that they want these services. And it's clear, once they are aware of that, that there's a research deficit. And once they are aware of that, it's also clear that there's more and more money coming for these kinds of research endeavors. And so I think from a bottom-up kind of strategy, if the nurses can kind of be this liaison and be this catalyst for change, that it really can make a big impact on how integrative medicine is utilized in cancer centers.
Wonderful. Yeah, those were some really, really good points that we talked about, what all of us can do. So I encourage each one of us to go back and look what your center offers and look up online, look up resources that you can educate yourself. I believe ONS and ONCC, we have continuing education classes and workshops to learn about complementary and alternative medicine. And I think Liana and Linda can talk a little bit more about what our society offers in terms of educating to the nurses. And of course, anyone else, you have ideas, feel free to pitch in after that. So, Liana, do you want to talk about what resources are available for the oncology staff and where they can go?
Well, there's some really basic resources that are available. NCI and NCCAM have a nice little pamphlet that we keep in our clinic, and it's just thinking about complementary and alternative medicine. And essentially, it's really just encouraging the patient to be open, and it has a lot of resources in the back, from the FDA to NCI, more traditional Western medicine resources. In our clinic, we also have some local resources. We have some massage therapists that come and do hand and foot massages in our clinic, and they have an oncology organization of massage therapists that have been specially trained, because a lot of massage therapists are afraid to touch people with cancer. So we have some organizations within our community where we've reached out and made collaborations with them. I live in Austin, Texas, and so we have Livestrong here, and Livestrong has a lot of really good resources for patients that really do have a very strong complementary and integrative therapy bent to them. So that's a nice resource that we have that also has some money behind it. I do feel like not having financial support for a lot of things that people want to do, everything from yoga classes to acupuncture, that's all patients have to pay for that themselves. And even though here in Austin I know of several acupuncture studios that will see patients on a sliding scale. They'll kind of let you budget for whatever, and if you don't have any money, they'll let you answer the phones. So, we do have resources like that here, but Austin is much more progressive than the rest of Texas, and probably a lot more progressive than a lot of the places our patients are. And because it is, and because the patients are young and they're looking out for themselves, they've changed the model so it's not so paternalistic like it used to be. But sometimes it is. The doctors still aren't out there making the recommendations. The nurses are. And I know where I work, I have pretty much free reign as long as I know what I'm talking about, which I do. And but I do think that one of the topics of conversation needs to be, where's the money? Where's the money for the patient to get acupuncture for their nausea that we don't have a good fix for? Their insurance will pay for a lot of things, but most people's insurance don't pay for acupuncture right now. And so I think coming up with finding ways for them to get connected is kind of the next level that we need to really start putting our energies into. So yeah, I think I might have given off of the topic, but
it's okay. I think you covered some great resources that we can all refer to. So NIH has an entire area for complementary and alternative medicine. So we can go to NIH website, and that has a lot of great and reliable information that is usually approved by all the centers. Similarly, NCI has, the National Cancer Institute has resources specifically for complementary and integrative medicine for cancer. And again, those are, since they're approved by NIH, it's acceptable at most centers. Plus, there are resources that are accessible from the ONS site and from SIO. So these are all very reliable resources that you can feel free to share with your community. And then the patients in the community that is looking for more, like what Anne and Luana said, there are a lot more resources like the Annie Appleseed Project that has a lot of information that we can share with our community.
And can I just say one thing?
Yeah.
When people with cancer are looking for resources, there's some information that came back that overwhelmingly they look to other cancer survivors. And so there is, there's advocates in every community that feel kindred to this cause. We have a model in New York City that's being replicated now. It's not hard to do in a community model, and it's evidence-based. And youcanthrive.org if anyone's interested. It's not hard to make a change in your community if you're passionate and you're driven.
Fantastic, great. Linda, do you want to add any resources if you think we haven't touched on it yet?
Yeah, there's a couple I'd like to touch on, particularly because natural health products are so popular among people living with cancer. I really do encourage nurses to work with their institutional librarian to get access to natural medicines. Natural Standards and Natural Medicine Comprehensive Database got together and formed Natural Medicines, and we basically call it our CPS for all natural health products, and it provides the same type of information around what the indications are, the contraindications, potential side effects, dosage if it's known, and it has links to all the various research studies, clinical trials, all the way down to the bench and mice model research that can let people really understand what the body of evidence is around complementary therapies. The other resource that I find is very user-friendly for patients and family members, as well as for people that are working in clinical settings, is the Memorial Sloan Kettering's Herbs and Botanical Database. They recently have launched the smartphone app called About Herbs that you can put onto your smartphone and very quickly at the bedside look up herbs, and the information is specific to cancer. And they have monographs that are for patients as well as for health professionals. So they've really worked at trying to keep the language at a level that patients can understand. And again, they have the references to the research articles, and I know that June and Gary Dang are working at updating it every 3 to 4 months. I also just want to have a shout out to ONS and Georgia Decker, who is a former member of the SIG. She has developed a course, and I believe it is still offered periodically through the ONS education services. And so if oncology nurses are wanting to get more of a grounding in this area, I do encourage nurses to seek out the course the next time that it's offered through ONS. And I do have to mention that my Cameo program, cameoprogram.org, also has an education program that's for health professionals. It's really focused on supporting patients in making informed decisions around these therapies, and has links to a lot of the resources that we've been talking about tonight.
Fantastic, great. Thank you so much, Linda. This brings me to my next question, and I know this question can get a little bit uncomfortable for us, so I'm just hoping that we can all express our own suggestions to the community, which is there are times that since we don't get formal education in complementary and alternative medicine, and the community is fractioned about the knowledge as well as their opinion in a particular healthcare center in terms of how people will respond, a lot of times a staff or a nurse might feel uncomfortable with this topic, and working with a patient or community where a person might be taking complementary and alternative medicine, especially they might be taking some herbs or supplements. So what can we suggest? What can a person who is in that situation do? I would love to hear some pieces of advice that is practical for a person in that situation, because not everybody knows everything, and we can't expect that. So what can they do if they come across a patient who's interested in this, or they're taking some herbs or solutions and they don't know what to do about it?
Maybe I can address that from a provider standpoint. And I think from a nursing standpoint, it's so important to really encourage your patients to communicate with their provider about what they're doing from a natural standpoint, because very often these natural products will interfere with the chemotherapy. And so it's so important for us to know what exactly they're taking. And very often they're not comfortable sharing that information with us as providers, but they feel comfortable with you as nurses. And so we really look for you to kind of, again, be that liaison to communicate effectively with the patient and really kind of encourage them to communicate with us as their providers what they're taking and what they're doing out there in the community.
So let me probe you a little bit deeper on this, if you don't mind. So what my experience has been is that as many providers are not trained on this topic, right? So, and if it's benefiting the patient, how do we address the fact that we want, if we are sharing this information with a provider, we want that the provider is educated and in a position to address this, rather than shutting off and saying, no, don't do anything, and that's because they did not have the opportunity to learn about these therapies. So what are your thoughts on that?
It is very challenging, and I think it's very challenging to find oncologists who are trained. I think what's essential is, again, finding community partners that you can trust. And so very often naturopathic physicians, and particularly naturopathic oncologists in the community, are in fact very thoughtful and know exactly what kind of interactions there are with particular supplements and botanicals and particular chemotherapies. So perhaps referral would be appropriate in that scenario. But I agree, it's very touchy in particular cancer centers. You know, once they're aware that these patients are taking particular supplements, they are pulled off therapy. And so all I can say is what we need to do to move the field forward is to continue to educate ourselves more as practitioners, and B, to add to the evidence base so that our practitioners can feel more comfortable with the combined modalities. But I think in this space right now, it's going to take probably a referral to somebody who is comfortable.
Great. Anyone else have thoughts on this topic?
I would say one resource in most communities, either if you're in a freestanding cancer clinic that has a pharmacy, if you have an oncology pharmacist that's available to you either in your clinic or even at the hospital, that might be a resource. Or if you have a holistic pharmacy. We have a kind of a chain of holistic pharmacies here that have not only, you know, traditional Western medicine things, but they also sell herbs and other supplements. And I've utilized them as a resource for people, you know, and ask the pharmacist, can you do the research on this and find out if it will interact with this medication or that medication? So those are some other, most, I think, communities would have an educated pharmacist that you could go to and have them help you with that piece if you couldn't find the information through national standards or one of the other available databases.
Okay, so refer to the community pharmacist who knows about the different drugs, right? The herbs and supplements.
And I can add to this as well, so I'm sure Anne can too. You go first, Anne.
I was going to say that one of the biggest problems we have, you know, again, I mentioned the vacuum, and when they don't get information, they make bad choices because they're not getting good information. One of the biggest problems is that people tend to take an herb or a supplement that acts just like a drug that they're already taking. And that, when in my talks, I constantly say to people, don't duplicate what you're already doing, because then you're getting a double dose, and you don't want that. But this really is because they're not getting the information. If ONS starts educating all the nurses in this area, it could make a gigantic difference. And of course, if it was covered by insurance, that would be like a fantastic thing. We all should work toward that. I talk about that constantly with my representatives, and I try to mention it weekly, if possible. It's really urgent.
Great, yes, good point. What else? What can nurses do if they're uncomfortable? Or
I myself feel, and I've been talking about this for a while, we know that patient navigators improve outcomes for patients. And many patient navigators are nurses, and many of them are passionate survivors. So giving patient navigators training in integrative, and you call them integrative navigators, you give them some tapping, you give them some basic information, and you have them explain to the patient what is evidence-based and how they can get good information so they're not going out and doing Venus flytrap because their friend's mother was cured on it, and there's absolutely no data on it whatsoever. Like, I consider myself an integrative patient navigator. Columbia has now hired an integrative patient navigator that's a survivor. Rather than hiring a nurse, they hired a survivor. But there's many nurses out there that are also survivors, and there's many nurse navigators that could get this information and be the go-between for that care between the doctors and the patients.
And what I think we need to recognize is that even with if we know all the research out there, that very often we're not guided well by the research, that it's just not done yet. And so what I think is very important is to kind of look at where is the patient in their treatment and what are our goals of therapy. And so say that there is a patient who presents and they're an early stage breast cancer who's potentially curable, and they're taking everything under the sun as far as supplements with no data about safety. In that scenario, perhaps is when we should steer those patients for a more conservative approach, and in contrast to patients who are metastatic. You know, we know that we're no longer going for a cure and that it's truly palliative chemotherapy, and so in that scenario, perhaps a more lenient approach to the supplements is more appropriate. So I really think it's very important to look at our goals of care and be sure that we're not doing any harm, first of all.
Okay, great. Any other thoughts before we move on?
You know, I think we have to remember that there are a lot of small studies of natural products. Supplements have been studied, but they're small because they don't have the money to do the level 1. They don't have $400 million. They can't be patented. Pharma tells me this all the time at meetings. They can't patent it. That's the end of their conversation, but it shouldn't be the end for a patient. When their problems are not being helped by treatment and they're being harmed and they know it. I mean, so many women say to me, you know, I had breast cancer, so lots of people I know have breast cancer, and they'll say stuff like, you know, tamoxifen is causing me problems, the AIs are causing me problems, chemotherapy caused problems, and then problem after problem after problem, and they're trying to find solutions because we just don't have those solutions in conventional medicine. So I'm willing to look at the smaller studies and sort of aggregate them, even though they really don't lend themselves to a meta-analysis because it's not going to reach that level. But if you have a lot of evidence, I call it a preponderance. Seems to me that would be open to to discussion. And I think that's something we really have to look at more carefully. I've looked at it for years. I think there's a lot of good information. Personally, I take a lot of supplements. I will say that. I take a lot. I always have. I change my diet. I exercise. I breathe deep breathing, all the things that I can do. And I'm still here after 23 years, no chemo, no radiation, because I couldn't take it. I had to make hard decisions, but it worked for me. Not that I'm special, just worked out.
And doesn't Annie, don't you have a pretty comprehensive list of the supplements and the things that can interfere with treatment? I know I have a list at You Can Thrive when people start taking curcumin and they're taking a carboplatin-based chemo, and you don't want them having interactions. So it is important to have that list, and maybe giving them a link where they could get that list too. So if they hear that someone is doing something that's going to interfere with tamoxifen or one of their treatments, they can have that on hand.
Yeah, we have it downloadable from our website on those kinds of things.
Can we have an opportunity for Kathleen to share her thoughts as a person that's done training in this area and as a nurse practitioner? I know she's been trying to say something.
Yes, definitely, Kathleen.
Can't hear.
We can't hear you, Kathleen.
Hear you.
Hello, Kathleen.
Yeah, it's impossible. Can't hear.
Yeah, I think maybe something might be a challenge with the audio. Actually, it brings me to the next question, which is about these different healing modalities, because a lot of times people don't know about the healing modalities and the research. I know we talked that it's very difficult to do large-scale studies but we have such an amazing panel here, and we all have some experience in different complementary and integrative modalities and know about research in that area. How about we go around and touch on that? And Kathleen, if your mic is working, we would love to hear from you. If not, then we can come back to you while you get set up. Also, I can tell from my background, I have studied Ayurveda, yoga, meditation, and several other healing modalities like aromatherapy and color therapy. And I came from that, from the healing modality profession into nursing. So I brought that with me as I came along. And what I found is that I already had seen the benefits of many of these modalities working in my practice and addressing many symptoms. So as I came into Western medicine and working mainstream, I was able to help about many symptoms in these modalities. And as I dug deeper, I was able to find that there is a lot of great research, in fact, on the use of many of the mind-body therapies, on the use of aromatherapy and use of Ayurveda, use of meditation. There's a lot of great research in that area, and in fact, that's what motivated me to start HelpSee, which is an online platform that provides access to information about these different healing modalities and access to experts in those areas. So that's where my intersection of the two has come in, and I found a lot of great research. You can look on PubMed, you can look on any of the research databases, and you will find ample research in most of the healing modalities. And I know we have a great panel here who have special focus in different areas of research and in practice. I would love for you to talk about those.
Well, hello, this is Suzanne, and I'm a music therapist. I'm actually a board-certified music therapist. Music therapy does indeed have a growing body of evidence to support its impact. And in oncology, so many nurses are using music listening, having a patient listen to their own familiar music that is important or meaningful to them, music that they enjoy listening to, as a focus of attention. And so music is benign, it's available, it's accessible. These days with our portable music devices, it's very easy to plug into some music. And music therapists are able to use their background in psychotherapy to engage the patient with the music, to help them to express the experience of having cancer, the experience of being hospitalized, the experience of coping with a disease like cancer. And so music therapists use a variety of both passive and very active musical engagements with patients, and have amassed a considerable body of scientific evidence about how music can help people cope with pain, cope with anxiety and stress, how they can deal with their symptoms better by something as simple as engaging with music. And with some very simple techniques, patients can learn how to condition a relaxation response, but also to experience joy, something they may have forgotten to appreciate in their lives when they're coping with such a devastating disease.
I'm so glad you brought up music therapy. It's so healing and so benign. It's very, very easy to incorporate that. And it's wonderful, the amazing benefits that we have from the music therapy. I really wish we could have heard from Kathleen on this topic. I know she comes with a lot of expertise in this area as well. We are having a little bit of tech glitches, so I will get message from Kathleen later on if we cannot hear from her right now, and we will post it in our comment section or some way of communicating her messages to you about it.
I could chip in a little bit about this because I think it's really important to talk about the difference between sound therapist and therapeutic sound, because sound therapists have a background in psychotherapy, but there's also therapeutic sound, which can be done in a group setting, and it's basically having those vibrational frequencies of overtone and harmonic emitting instruments, which actually put the brain waves into meditative or flatter brainwave states where the body can better heal itself. So that's the modality. Is I really believe that music and vibration is such an important modality and so benevolent and beneficial on so many levels. We use it every single week. We have a group therapeutic sound here, and we combine it with Reiki, and it's just all the people say it's very, very powerful.
Great, wonderful. And I know we have a lot of other great therapies to talk about, so I'd love to hear from other people on our panel. Liana, do you want to talk about your Qigong, and then perhaps Christina can talk about yoga?
Sure. So Qigong, as I mentioned, is part of traditional Chinese medicine. Tai Chi would be considered a form of Qigong, which most people are familiar with. But really it's a moving meditation. And for me, it's very hard for me to sit still and meditate. And that's what I was drawn to about this. Being able to move my body helps me to calm my mind and kind of get integrated within myself. And through that, I've actually learned how to meditate again without moving, which is probably a greater goal and something that's attainable by most people. I have lots of patients that come to me, and they use meditative techniques to get through lab draws, their chemotherapy, their accessing their ports, anything that they find discomforting. And so I really think, being able to use our minds to overcome the matter of our lives is something that we all can attain. And there are many, many ways to do that. So I think that the Reiki and music therapy, meditation, deep breathing, I'm sure yoga, it to some extent does the same thing. But I've actually had some patients start coming to my Qigong class, which has been really fun. The people that were really having a hard time dealing with their anxiety about decision making. And I said, you just need to get out of your head and into your body so that you know what's right for you instead of letting everybody else tell you what to do. And I find that they're much more at peace with their decisions when they can do that. So that's one of the big benefits, I think, is getting people.
Wonderful. Wonderful. Yeah. So let's have let's touch a little bit on yoga and any other therapy we want to talk about, and then we can take questions. We got a lot of interesting questions.
Could I just ask whether nutrition qualifies as a complementary modality? Because I like to start people with that. My organization has this thing called 3 Steps for Health. The first step is 1 more fruit and 1 more vegetable a day. Very few Americans are eating enough of that, and we really feel that's important. The second step is taking a walk, and the third step is taking 7 deep breaths to calm. And I think that covers. I think nutrition really needs to be part of any conversation with people with cancer.
And it does fall under the category. Nutrition and exercise do fall under complementary integrative therapies, even though they're really kind of lifestyle.
Cool. Yeah, that's a great point, Anne. And go ahead, Christina.
Oh, I was just echoing that food is medicine, and Hippocrates said that long, long ago. And so I think food is really the most important and the most essential intervention that we can really start with our patients. So I definitely incorporate it and think it's complementary.
Great.
Well, now that I'm talking, I'll talk just a little bit about yoga. I am very passionate about meditative movement, and I think that it is truly utilizing the mind, body, and spirit. And so I think there's something very special about these interventions, Tai Chi, Qigong, and yoga. And there is evidence for them. Even in large journals such as JCO, you've probably seen in the last few years large randomized controlled trials for yoga in breast cancer and patients undergoing radiotherapy. And there's also biomarkers now that they're trying to come up with a pathophysiologic rationale for how these are exerting their influences. And so I think that the research is going to the next level. And what I think is interesting is to try to do it in a novel way. And so one of my clinical trials is an online yoga intervention where patients can access their yoga through a web page, through an online yoga library. And so it's cheaper that way, it's more accessible, and very often more comfortable that way for the patients, although they're not getting the social support which maybe they would be getting in the class. So I think there's novel ways to do research in this space, and perhaps it may benefit the patients moving forward to kind of look at different and interesting ways to utilize these complementary therapies, such as we're doing now, webinars and online interventions.
Great, fantastic. Thank you so much for touching on that. So now we have quite a few interesting questions.
Really quick, can I talk about the woo-woo stuff for 1 second?
Sure.
So I would be bereft if I didn't mention Reiki, and I know we mentioned it really quick combined with the therapeutic sound. But there definitely needs to be more studies done on this, more good studies done on it. But they are using it at certain hospitals like Columbia during surgery. And I happen to be one of the practitioners that can go into surgery with the surgeons, and it's amazing to see the difference. But recently I went through a double mastectomy myself, and I had Reiki by the bedside and in surgery with me, and I have to say it felt like there was an elephant stepping on my chest, but my limbs were floating, and I did not press that button. And so we now send Reiki to the bedside of anyone who gets a mastectomy that's a member, but I would really like to see more evidence on this. The problem with it is it's very practitioner oriented, and it flows differently through everyone, and people train differently energetically, so it's very hard to get the evidence.
It's also very hard to get the research. It's also very hard to get the research funding. I tried several times to get a trial funded in Reiki, and the reviewers called it woo-woo and said there was no point in doing research on it. So it's a struggle, but I think things are shifting, and people are starting to recognize that we can't say something doesn't work until we have some evidence around it.
Thank you. Wonderful.
Absolutely, great point. Great point. We need to send this video lecture to NIH and NCI too, so they hear our viewpoint. Well, so among all the questions, I want to touch on some of the hot questions. So one of them is, can you speak about insurance support for integrative medicine, either in oncology patients or health maintenance? So what can nurses tell people? What can we offer them?
That's a tough one.
Yeah, in most hospitals, it's been philanthropy for the first few years, at least, when they start an integrative department. There's charitable donations that have been covering it, and then people are left on their own. Very troubling.
I'm afraid I don't have any current and specific information, but I am aware that certain insurance carriers have a rider, so that if you purchase this rider on top of your insurance package, you can have access to integrative medicine and health practitioners. And they have an approved list. Again, I'm sorry that I don't have that information right in front of me, but there are indeed some of these insurance providers.
And if you look at these services individually, some of them are covered. Nutrition is typically covered, at least a one-time consult. Acupuncture is becoming more widely covered depending on the insurance provider, as is massage. And so I think, you know, it just depends on the insurer and what particular services that they're covering. But as far as widespread service coverage, we have a ways to go.
Is Kathleen's mic on yet?
Yes, it is. Kathleen, you want to pitch in?
Oh. No.
No. Well, with music therapy, the benefit is that if you can find great DVDs, great online channels, like Pandora has free channels, you can get some of the therapies for free or for very cheap, such as music, meditation, yoga. There are a lot of great resources available online for it. And as some of our panelists mentioned, you can ask your provider, and they might be able to prescribe a consult for you. So you can request for prescribing consult for physical therapy or for massage, for nutrition, for acupuncture. Sometimes even chiropractor is covered by some insurance with a copay. And I have actually used all of them, and they have all been covered by insurance. So I know insurance varies across different providers, but this is something to look into, and also what resources can be available for free. In addition, many providers who work in this space, they are very passionate about it and are very accommodating to doing a sliding scale or some kind of conversation with you about how to make it into a price that works for you. So those are some avenues to look at.
And I think the research is so important too, because when we start, like Neil Barnard, right? When heart disease and diabetes, we know that long-term healing is really about changing the milieu, the environment, the cellular environment, and how the cells express themselves. Because if you've got this perfect storm of cancer, then the chances are your environment is influencing that. And so I think that it's really important to get the treatment, but if you don't, to change your lifestyle and start looking at your risk factors. And Neil Barnard came up with a model for heart disease and diabetes that you might know, but it's being paid for by Medicare now. And it's vegan diet, meditation and stress reduction, and exercise. And he proved scientifically that it's low. It's going to reduce the cost. It's less than putting more stints in. And that's what we have to do with integrative care.
Great, great. That would be great. Let me move on to the next question, because that's an important one too. Is what type of credentials should nurses consider before referring patients to any complementary and integrative medicine provider?
Here in Canada, I often tell people that they should be looking for someone that is part of a regulated health profession, and we have many of our CAM practitioners that are regulated through our provincial laws, and they're members of an association, and they have very formalized scopes of practice. Not all CAM practitioners, though, have that type of regulation or are a member of an association, and that's where I usually will tell people to look at where they're training from. Have they worked with people in oncology? Have they had a specialty training, like some naturopathic physicians can get oncology training that's specialized? And I guess, you know, the important thing is also word of mouth, because sometimes you do hear about practitioners that are very patient-centered, and then you'll hear about the practitioners that raise some alarm bells. And I think it's important that there's dialogue among the community regarding those types of concerns, and that patients kind of look for some of the warning signs, you know, asking for thousands and thousands of dollars, making claims that are unsubstantiated, having no clear treatment plan, and having no outcomes of their treatments. That's when you need to be a bit concerned. I've also seen them being recommended to stop all your medication completely, including pain medication. That raises concerns in my mind.
Okay. Great. Anything else we want to talk about the credentials? How can people know who are not familiar with this space?
Well, I think, you know, it's the same in the U.S. We have national accreditation boards for all the different kinds of professions, and you can easily see if someone's licensed and what their qualifications are by checking with those organizations. That's what I do.
Yeah, so great point, Linda and Anne. So in fact, a little bit giveaway from SIO, what we have been working on is actually making a list of all the different accredited centers that are available, accredited centers in US for the different healing modalities. So we are hoping that is one goal that we have at SIO. So we will be working on that, and we hope to be able to provide more easily accessible information about the accreditation levels for the different integrative medicine professions under the leadership of the SIO community. So keep a watch out on that from us. Great. So I'll move on to the next question. Okay, so patients can respond better or worse to different type of CAM therapies. How can a provider make that decision, or what can they do to help with that decision?
I think that's the million-dollar question, isn't it? I mean, we really do not know. It's a kind of thing until you find something that works.
I think it's essential to really have a good conversation with the patient and ask them what kind of things have they heard of, what do they think may work for them, because they are already kind of exhibiting a bias, and really just talking out with them, you know, what are potential therapies that they identify as being helpful. And I think that starting with those is a good place.
I agree.
I also think that from an integrative perspective, we really want to help patients build a strong foundation, and then adding and layering the pieces that are important to them. But I think looking at their nutrition, their exercise, and their sleep, and their stress management. And I really see the mind-body therapies as a great place. It's sort of the horse leading the cart. I think when people can learn a mind-body modality and start to practice it, it really helps with integrating the other pieces. And I often have people journal, because I think it can be very subtle, the changes that happen with some of the integrative modalities, and using journaling can be very powerful and empowering along with all of these modalities. So you can hear me now?
Yeah. Yes, yes. Wonderful.
I don't know what I did.
No worries. Well, that was wonderful. Thank you so much. And in fact, the next question is perfect for you. So we have an audience. They want to know about international music. So the question is, I would like to become more comfortable with listening to international music. Can you please suggest a resource where I can learn more about choosing music for relaxation for myself or my patients?
So I'd be happy to respond to that.
Yes, I'm hoping you and Kathleen respond to that.
Well, I think that the most important and potentially effective music in terms of having some impact on how you're feeling and your mood and your symptoms and any distress that you're experiencing will be the music that is most meaningful to you. Music that is associated with wonderful times in your life. Music that has memories of great people and great times. Music that, when you close your eyes, you picture the most beautiful scene. And music that you believe offers a peak experience for you. Music that you find so beautiful. And there is, of course, music from many cultures and many worlds. And as you pointed out, Sangeeta, we have access now online with iTunes to purchase bits of music, to sample them, and to purchase music from all over the world. And the novelty of a new piece of music brings that focus of attention, just like a chant would, just like some forms of meditation and focus on the breath would. But the music is working your whole brain and bringing you to exotic places, a place that is magical or a place that's very real and familiar and like home. So I suggest that people experiment with the music. And I think music therapists really teach people not just how to listen to music, but how to listen to the reaction that their bodies, their minds, and their spirits have to that music.
I think that's just a such a beautiful answer, and I had a wonderful experience when I was doing more inpatient integrative health with one particular gentleman who just loved rock and roll. And I was doing Reiki, and I was used to doing very gentle, soothing music. And he was about my age, and he really loved the Rolling Stones and, you know, just a whole variety. And that's what we did, you know, meet people where they're at, and that's what we did. And I did it with him for about a month, actually. And I remember one day his doctor walked in, and he's like, whoa, you know, what's going on here? I said, well, it's rock and roll Reiki, you know, and he got a lot of pleasure. He became very relaxed. It helped him sleep. So I couldn't add really to what you said, except I think also the science, with the ability to look with functional MRI at the brain and how it works with guided imagery and its effects on the cells, I think we're learning more and more about that. So I think music is really an amazing thing to add with what we're doing.
Wonderful. Wow. What a great panel. I know, I'm sure that there will always be more questions, but we are above time. So I want to thank each and every one of you for being here and sharing your thoughts and educating the community about complementary and alternative medicine and bringing so many beautiful perspectives. I know this is a start for all our members. I now encourage and challenge each one of our members to look for something related to CAM, understand what this is, and do one thing this week that is going to help you apply it with your community. Share it with your friends, your nurses, bring it up in your huddle so your colleagues know about it and they can start to explore it, because this is just the starting of access to this knowledge and the services that we can bring to our community so we can help our patients live and thrive better. So I want to thank all of you for listening. And if you have questions, please feel free to continue posting. We will try our best to still keep addressing it on the comments. And I want to thank our panel so much for taking the time to share their views. Thank you so much, everybody. ONS Staff Education SIG and ONS CAM SIG are very, very grateful to you for your time.
Thank you.
Have a good night.
Thank you. That was wonderful.
Bye now.
Bye-bye.